A postpartum client delivered 1 hour ago. The nurse finds that the uterus is firm, but the patient continues to have heavy vaginal bleeding. What is the most likely cause? The right answer is option C, vaginal or cervical laceration. Rationale is a firm uterus means the uterus is contracting normally. If heavy bleeding continues despite a firm fundus, the bleeding is likely coming from a tear in the cervix, vagina, or perineum. Extra point is bogey uterus plus bleeding is equal to uterine atony. Firm uterus plus bleeding means laceration. So in this question, it is firm uterus plus bleeding plus bleeding. Next question. A patient with severe preeclampsia suddenly develops absent deep tendon reflexes while receiving magnesium sulfate. What should the nurse do first? The right answer is option B, stop magnesium sulfate infusion. The rationale is absent reflexes are an early sign of magnesium toxicity. The infusion should be stopped immediately to prevent respiratory depression and cardiac arrest. Extra point is the signs of magnesium toxicity is absent reflexes, respiratory rate less than 12 per minute, urine output less than 30 ml per hour. The third question. A laboring client has a fetal heart rate of 90 beats per minute for 12 minutes. What is the nurse's priority action? The right answer is option B. Reposition the mother and administer the oxygen. Rationale is a fetal heart rate below 110 beats per minute for more than 10 minutes is fetal bradycardia and it may indicate the fetal distress. Extra point is normal fetal heart rate is 110 to 160 beats per minute. When fetal distress occurs, turn mother to left side. Stop oxytocin, give oxygen, increase IV fluids. If anyone need this explanation in Hindi, please comment below. I will explain in Hindi in next video onwards. Question number 4. A pregnant woman at 36 weeks reports a sudden gush of painless vaginal bleeding, followed by fetal bradycardia. The nurse suspects what? The right answer is option C, vasa previa. Rationale is vasa previa occurs when fetal blood vessels cross the cervical opening. When membranes rupture, fetal vessels may tear, causing fetal bleeding and bradycardia. This condition can rapidly become fatal for the fetus. The NCLEX tip is painless bleeding plus fetal distress after ROM is equal to, it means it is vasa previa. Next question. A patient at 39 weeks has an amniotic fluid index AFI of 2 cm. What complication is the fetus most at risk for what? The right answer is option A, cord compression. Rationale is an AFI of 2 cm indicates severe oligohydramnios. Less amniotic fluid means less cushioning around the umbilical cord. Normal AFI is 5 to 25 cm. NCLEX tip. Oligohydramnios, cord compression, variable deceleration. Okay. If AFI is less than 5 centimeter, then it will cause oligohydramnios and it leads to cord compression. Then we will call it is variable decelerations. Moving to the next question. Question number 6. A woman at 30 weeks gestation reports a severe headache, blurred vision, and right upper quadrant pain. Which action is most important? The right answer is option B, assess BP immediately. Rationale is these are the classic warning signs of severe preeclampsia and possible progression to eclampsia. Severe preeclampsia can lead to seizures, stroke, HELLP syndrome, etc. The tip is headache plus vision change plus right upper quadrant pain leads to severe preeclampsia. Next question. Seventh question. During labor, the fetal monitor shows variable deceleration. What is the most likely cause? The right answer is option C, umbilical cord compression. Rationale is variable decelerations are abrupt drops in fetal heart rate caused by temporary compression of the umbilical cord. Changing the mother's position often improves variable decelerations. Next question. Question number 8. A client or patient with gestational diabetes gives birth. Which newborn assessment finding requires immediate attention? Right answer is option A, blood glucose 32 milligram per deciliter. The rationale is newborns of diabetic mothers are at high risk for hypoglycemia after birth. Normal newborn blood glucose is generally above 40 mg per deciliter. Diabetic mother is equal to hypoglycemic baby. A diabetic mother always have a risk of hypoglycemic baby. Question number 9. A nurse is caring for a patient with a prolapsed umbilical cord. Which position is best while awaiting emergency delivery? The right answer is option C, Tredelenburg or Nietzsche's position. Rationale is these positions reduce pressure on the prolapsed cord and improve the blood flow to the fetus. The nurse should also manually lift the presenting part of the cord. The tip is cord prolapse is equal to knee chest plus hand elevating presenting part. Okay, it means if any patient having cord prolapse, then we have to provide knee chest position and hand elevate the presenting part by hand. 10th question. A postpartum patient suddenly develops shortness of breath, chest pain, and cyanosis. What is the priority diagnosis? The right answer is option B, pulmonary embolism. Rationale is sudden chest pain and breathing difficulty after delivery are the classic signs of pulmonary embolism. Pulmonary embolism is a life-threatening emergency requiring immediate intervention. The tip is sudden shortness of breath with chest pain after postpartum is equal to which leads to pulmonary embolism until proven otherwise.